Hello, everyone. Welcome to today's episode of the Glow podcast. I have a very exciting guest here with us today. And for those of you kind of just joining us, we are Tailored Marketing. We help dermatologists, skincare clinics, and aesthetic clinics grow their practices and increase their revenue. So if you're interested, drop a comment below. And thank you so much for joining us. I would like you to just kind of go ahead and give a little bit of an introduction to who you are, what you do, so the audience knows.
Yeah, thank you. Nice to be here, Taylor.
Yeah.
So first of all, thank you for highlighting this condition disease. So we're going to go through a lot of interesting things. So my name is Dr. David Amron. I'm located in Los Angeles, California. I've been in practice 31 years. I'm a dermatologic surgeon, and I founded the Roxbury Institute with centers in Los Angeles, Salt Lake City, and Tucson, Arizona. And we are a leading therapeutic center for fat disorders in North America, and we're going to talk about that. And the main program we're going to talk about is the Advanced Lipedema Treatment Program, which I pioneered this whole area of lipedema surgery. So I'm excited to talk about it.
Thank you so much for giving a little bit of an introduction, Dr. Amron. And yeah, so I guess talking a little bit more, going straight into it about lipedema, what is lipedema and how is it kind of different from other conditions like obesity that people are a little bit more familiar with?
Yeah, so lipedema is a very under-recognized fat storage condition. So it was first originally defined in 1940 at the Mayo Clinic, but still very few people really know about it. It is a genetic condition. You pick up the gene directly from a parent. Mother or father could be carrying the gene, as we'll talk about. And it begins to present around puberty. It affects about 10% of the female population in varying degrees. So it's really quite a common gene. And it presents in puberty with initial signs. You get this kind of loss of contour, first in the legs. Many times there's just some swelling around the ankle area, and you'll begin to kind of lose the shapeliness of the legs. And girls at that point are many times asking, kind of what's going on. They're noticing they're different than their peers. They're told many times just to lose weight. It gets progressively worse throughout a person's lifetime, picks up in activity with other hormonal changes of puberty and puberty, like we talked about, pregnancy, menopause, other hormonal changes, and has a characteristic look to it. And as you begin to get tuned into it, it's not that difficult to diagnose. Most patients that I see are really diagnosing themselves based on the common signs and symptoms. And it has this column-like look to the legs, typically from the groin area down all the way to the lower legs and ankle area, where it wraps around the legs. The arms eventually get affected later on. And you have this characteristic disproportion in a person's body that never really corrects itself. And there's symptoms that go along with it too, which is tenderness to pressure, commonly pain, sensitivity. Patients say that when I dog jumps on me, I get a massage done, it's more tender. There's easy bruisability, there's swelling, and a lot of patients have hyperflexibility of their joints. And it's different from just obesity. That's the problem. Patients are just told go lose weight, eat less, diet, exercise. That goes on their whole life. In their 20s, 30s, 40s, 50s, 60s, they're just misdiagnosed as being overweight. And the thing is that they are disproportionate. That's the first thing. They many times have narrower torsos and their arms and legs are fuller. So it's this disproportion. It's not just being overweight. And it's different than lymphedema, which it sounds a lot like, which is a different condition. Lymphedema is typically not genetic. It's unilateral in one leg, doesn't have a lot of the symptoms of lipedema. It just tends to sound like lymphedema. That's one of the problems in terms of its lack of recognition, that it was given a name that sounds too much like lymphedema.
Yeah, wow. Yeah, that is interesting. You talked a little bit about to the genetics. Could you talk a little bit more to that and different risk factors that are associated with lipedema?
Yeah, well, because it is genetic, unfortunately, there's not a control, at least now, in terms of picking up the gene for it. If you pick up the gene for it from a mother or father, again, so a father could be carrying the gene but rarely express signs of it. You'll have to generally look at the females on his side of the family, his mother, his grandmother, his sisters to find evidence of it. But the gene is passed down with a 50% chance. So once the patient has or person has a gene, there's a 50% chance of picking up. It's called autosomal dominant. So there's really not, unfortunately, a lot you can do to pick up the gene. When it begins to present, though, there's a lot of things preventively that can be done. It's really important. proper dietary strategy. It's not just dieting. It's avoiding the triggers of lipedema that can create more inflammation and swelling, such as gluten and sugar and alcohol and refined products and dairy products. Compression therapy is another thing that can be done to slow the progression of it. But living a lifestyle that's in line with lipedema is important to slow the progression of it. And then, of course, as we'll talk about surgery, at some point, surgery is a consideration. So, it's not so much these risk factors for it. It's a genetic condition that you unfortunately can't really avoid. And it runs pretty much the gamut of all ethnicities. I've seen it in every single ethnicity. I get asked that a lot: Caucasian, Hispanic, Asian, Indian, Black. It's in every single ethnicity. I would think, maybe Chinese and Japanese less of an incidence I've probably seen with it, but it still runs the gamut across all ethnicities.
And so you were talking a little bit too, kind of, you have to live a lifestyle with accordance kind of to lipedema. So what does that lifestyle sort of look like for patients, where they can help maybe with controlling this a little bit more?
Well, prevention is hugely important. That's why, diagnosis, it's got to start with the right diagnosis. And I've said this for years. We got to start diagnosing when it presents at puberty, the teenage years. OBGYNs, pediatricians should be picking up. It's not that difficult to diagnose. It's got to be taught in medical schools. So it's got to be
Yeah.
diagnosed properly, because at that point, there is a lot you can do to slow the progression of it, with proper dietary strategy and all that stuff we're going to talk about. And I started my center in Arizona, led by Dr. Karen Herbst, is really focused on diagnosis and prevention. And she does a lot of sophisticated testing, inflammatory testing, genetic testing, and this that to get into the minutia of prevention. But from a basic level, patients should begin to be on respectful diets. So generally, grains and gluten are things that can trigger more inflammation with lipedema. A lot of these patients have gut issues like leaky gut syndrome that many times they begin to learn is kind of related to the lipedema with their gluten intolerance with things. Sugars are generally a no-no with it, or especially refined sugars. Alcohol will tend to cause more vasodilation and more swelling. Dairy products generally are more inflammatory with lipedema. There's a lot of good information online now about it, which is good
Yeah.
to see, about dietary strategies. And generally their diets are kind of more on the ketogenic side of things. There's some good books written about it. So there's a lot of good information. And then again, compression therapy is important. So patients will begin to have an increased risk of swelling, and they should start to learn all the different strategies in terms of controlling swelling. Starts with compression garments, types of compression garments to wear on a daily basis, ideally with it, or at least when they travel or exercise when they're prone to swelling. There's other compression measures. They should ideally find themselves hooked up with a good lymphatic therapist, a manual lymphatic drainage therapist, certified lymphatic therapist who understands lipedema, that can guide the patient in terms of compression and other strategies like certain lymphatic massages will help with it. For more advanced patients, bandaging and wrapping is important on patients. Pump therapy is important on patients. Vibrational plate therapy is important on patients they could do at home. So it really is primarily in those categories, the lifestyle changes.
That's awesome to hear, kind of, that it is something that is, like you said, it's very, very important with preventative care, and kind of, if you can help with controlling these different things, then people can go on to, live very, very normal lives and not have it affect them too much.
Well, let me just jump in there. Yes, they can. There's a lot they can do in terms of prevention, but it's still, despite sometimes the best strategies, there are a lot of patients and it still continues to advance with things.
Yeah.
They should understand that and not again blame themselves because they're not doing enough. That's the problem with this patient group. They've been blamed and shamed from a young age. You need to do this and that, or you're not eating properly, and the blame's on them. And despite their best efforts, they begin to get discouraged, and it still continues to progress because in some
Yeah,
cases it's more of an advanced presentation of it. And that's where surgery, as we'll talk about, begins to be an important consideration in patients,
for sure.
especially
No,
certain
that
patients. Yeah,
that
certain patients.
definitely makes sense. And what led you to kind of specialize in treating lipedema, and how has your understanding, because obviously you're a complete expert in it, how has your understanding of this condition evolved over time?
Yeah, well, I get asked that a lot also. It's really a wonderful kind of history in marriage, me and lipedema. I decided 30 years ago, over 30 years ago, to focus my entire practice on liposuction surgery, all different aspects of it. Certainly a ton of cosmetic patients, a lot of complicated revision stuff, and these complicated, weird areas that nobody was doing. There was just no information about things such as calves and ankles and forearms. So I developed the techniques for these areas back then. And that really led the lipedema patients, because it involves those weird areas, to seek me out. And I was the only one doing all these types of surgery. So I really did develop and pioneer this whole area of it. And then I began to just get more and more dedicated and focused in my own practice about it. Not just me surgically, I began to develop all these protocols and carefully advance areas and ways, complicated areas, patients over 5 liters, and all these different parameters. And then it's expanded to my centers, all the protocols we have, my dedicated teams and things. So now proudly we're the leading therapeutic centers for lipedema in North America, and we're just building upon that. So that's a kind of marriage of things. It's just incredibly fulfilling to me, because I've always said, we go into medicine, at least I went into, for basically two reasons. I loved science as a kid, and I wanted to help people. And with lipedema, it really is so much about that. All those years of treating cosmetic patients, I'm now taking all those skills and applying them to the treatment advancement of this disease. And it's just so incredibly gratifying. I have patients and families and husbands that just, hug me every day. And it's just, I love it. So I feel this important position, this responsibility in terms of what I can do for lipedema.
Yeah, no, that makes sense for sure. It's definitely something where we need a lot of help in this country, and not a lot of people are aware of it, even as you've already pointed out. And so, with kind of this awareness of this disease being a little bit lower than some of the other things, are patients typically left kind of searching for answers when finding a provider because there's not enough attention to this specific sector of the medical field?
Yeah, absolutely. I mean, 110%. I mean, it used to be 130%, and now it's still 110%. It's a huge problem. There's all these kind of obstacles to, like, care and diagnosis. And, it starts with the what I call ignorance. And I don't use the word ignorance, calling it stupidity, but it's been ignored.
Yeah,
We got to start teaching in medical schools, and got to start getting doctors to recognize, because it begins with knowledge, which is power, and that begins accurate diagnosis. And then, yes, absolutely, more and more people need to begin to start understanding lipedema, to be able to diagnose it properly with it. I mean, it's such a common disease, 10%.
yeah,
We're diagnosing and screening for diseases that are far less common than lipedema. Why aren't we screening for lipedema? So we get them on the right track with things. A lot of these patients begin with, or end up with eating disorders early on. So yeah, huge obstacles with that, with diagnosis to begin with, proper treatment of it, surgery also, and then we'll talk about insurance. Another big obstacle.
for sure. And what does a typical treatment plan for diagnosis to intervention and to recovery look like for a patient with lipedema?
Well, I can speak to how we do things,
Yeah,
which
of
is
course.
been really highly developed. It starts with the educational stuff that we do, and the awareness we try to bring about, in all these different parameters. Shows I've done, webinar things we do, books I've written. The way in which we represent and educate the public about things. It begins with that, so people can begin to understand. Typically, we'll find out about through the internet somehow. I asked one of the first questions I ask patients: "How did you hear about lipedema?" And typically, 90% it's social media and the internet, which is it's cool. It's I guess a powerful tool these days. And
For
then they,
sure.
will start, they have their aha moment. I mean, do I have this condition? It kind of like this, like, wow, it's like, they're kind of self-diagnosing themselves, and they begin to look for providers, and they eventually will typically find their way to me or to us in terms of therapy, and they contact us, and they reach out, and then we have dedicated coordinators up front that really spend a lot of time with patients, guiding them, educating them about things. It's not just they're like answering phones and book your appointment now. We really care a lot about the understanding of things, and then typically a consultation is scheduled if it's just simply diagnosis. They'll see one of the other providers or Dr. Karen Herbst in Arizona. If it's a path towards surgery, then they'll get scheduled with one of the surgeons, either myself or Dr. Ari or Dr. Smart, for a consultation. That typically is a 1 hour consultation. Most patients are they come from other places, either outside the country or all the different states around the US. And they typically, it's a virtual consultation that is done, or they fly in for the consultation. And then at the end of the consultation, and it's a very structured consultation in terms of information and understanding of things, but at the end, a treatment plan is made, a surgical treatment plan, if it's a surgical patient. If it's a diagnostic and preventive thing, then we give them preventative guidance. If we look into certain inflammatory conditions and this and that, then that appointment will be scheduled with Dr. Herbst in terms of all this different testing. But the plan itself is typically a 2 to 3 surgery plan. An average patient is 2 to 2.5 surgeries. It's typically a 2-trip plan with certain groupings of cosmetic units, as I talk about it. All this stuff is in my book. There's a lot of good information about it. In that book, Liposculpture Surgery, a guide for patients, and pearls for the surgeon, and there's a whole chapter on lipedema. So I'll plug the book right there. But it goes into understanding, the treatment plan, how I develop it. It's a really important thing. It's not just typical liposuction, and that's a whole other
Yeah.
area. It's like, I get asked that a lot. Why is it different than cosmetic liposuction? So many different reasons. It's a disease. There's scar tissue fibrosis. Patients have specific risk factors. You've got to understand decongestive therapy in-house. You can't just dabble in lipedema surgery, I've said. So a treatment plan is made for the patient, and then they go through my insurance team and insurance process, which I have to try to really battle with insurance companies to get it recognized as a disease that it really is. Unfortunately, it is a
Yeah.
challenge to try to get insurance coverage for patients. We can talk about that a lot. And then typically surgery is scheduled, and they come in for a preoperative appointment is done. They fly in the day before with their family member. Surgery's the next day. They're there for usually a few days. They'll go back post-operative day 3, so typically it's 5 days and 4 nights. The surgery is typically about a 2 to 3 hour surgery. We can go to the details of that. They go home with a friend or family member. They do decongestive therapy in my center for 3 days. They're in garments for typically a month. They go back home. They'll pick up decongestive therapy with a qualified decongestive therapist twice a week for 4 weeks. They begin to see life-changing improvements typically in the first month, and it just gets better and better. Typically, their final results are 6 to 12 months, and it's just a massive improvement, life-changing improvement, both in terms of how they feel, the preventative measures, and how they look too. So you're accomplishing both with properly done lipedema surgery.
And I want to definitely go back and talk about the insurance, but before we do that, I would like to talk about kind of that transformation a little bit more, what it looks like pre-op versus post-op when they're done with their surgery and they're recovered. How does that affect their lives from before having surgery, with socially, everything that they're socially, physically, and emotionally? How does that kind of affect them from before to after? Because I'm sure it's a huge transformation.
Yeah, I mean, I still I still continue to appreciate. And every week I'm doing this stuff, every day I'm doing this stuff, what a transformation is for patients, what it really means to them. And I can just tell you all these things I hear. It's typically a life-changing transformation. It rarely is not, both in terms of how they feel. Their pain is if they have a lot of pain, is typically gone or massively improved. Their swelling is hugely improved with things. Their mobility is hugely improved. I can tell you how many times, Dr. I can dance, I can play with my grandkids, I go on hikes that I couldn't do. Their energy is improved. They look so much better. There's just such a dramatic improvement in terms of how they look. They can get into ski boots or boots they never wore before, or clothing they couldn't wear before, and they can feel more comfortable about things with it. It's just, and not only just the patient, their husbands or significant others, family members, feel it too, because they've been suffering with the patients also. So it's not, the beauty is it's like you're just changing lives of families with things, daughters, mothers, husbands, it's just great. Emotionally, I think it's a huge transformation. It's like it's just a relief. It's the fear, I guess, of the condition getting worse. They're feeling so much better about with things. They're feeling more confidence with things. Rarely, I'll tell you that you have some patients that as you try to understand the psychological components of what's been going on, because a lot of patients have, body, image issues. It's affected their confidence with things. Sometimes I would think that it just is such a huge life-changing improvement, but sometimes patients have a hard time accepting that improvement, that their new body is so different in ways. I mean,
Yeah.
it's smaller. Maybe there's a little bit of grief over their old self in a certain way. I don't know. But I've had some patients that their transformation, even though it's just you look at them physically, they're like, oh my goodness, it just looks amazing. They have a hard time accepting that transformation. So
No, that
just
makes
in all
sense.
these different in all these different areas, the changes take place.
For sure. I feel like, yeah, that would be a little bit of a shock for people because you're so used to the way things were and now everything's better, but sometimes it is hard to just accept change to start, even if it's change for the better, of course.
Maybe there's a guiltiness, that goes along with it, that I think I've had a lot of patients that are so used to trying so hard with things, they don't give up, that they feel in some ways like they did surgery and it's taking the easy way out and stuff like that. And I don't know, but that's pretty rare, I gotta tell you.
Yeah.
I mean, that's probably, I don't know, 1 or 2%. Most patients just, oh my God, what a
Yeah.
just, what a phenomenal, just life-changing thing.
Yeah, no, for sure. And that is what I feel like you would expect for the most part. But of course, there are the people, like you said, that the small percentage that maybe they feel guilty because they think they took like the easy way out, quote unquote. But if you're struggling with something, especially if it's a disease, it's something you can't control, you have to take action. And this is the best action that they can take.
You say in medicine you learn from your patients, and it really is true. But I mean, I'll tell you, with lipedema, over the decades I've been involved with, it's just such an amazing thing. You keep on learning all these different aspects of things. I mean, generally, you people into kind of different patterns because that goes on. You begin to see the commonality, but sometimes there's these outliers that you learn from with things. So it all goes with just taking care of all these different patients with lipedema. It's great.
Yeah. No, and earlier you talked a little bit to the insurance aspect of the surgeries that you do, and you said it's kind of hard to talk to some of these insurance companies because they maybe don't understand fully that it is medically necessary for these surgeries to happen. So could you speak kind of a little bit more to that and how you go about handling that with insurance companies?
Yeah, well, I have a long history with them, and I kind of feel like I am proud that I've been instrumental in terms of getting it recognized by insurance companies. It began years ago. Stanley Roxon from Stanford and Karen Herbst and I were in a class action case against one of the main providers. I'll just say it was, Blue Cross with it, trying to battle and get it recognized for patients. And that began to change things. It began to then be written in their policies with things and began to be recognized, which was a really great win. And it's come a long way in a way, but it's still slow. It's still a challenge with companies. I'm in network with Aetna, which is fantastic. The other PPOs, it's a constant battle with things. The HMOs are even more problematic with it in terms of recognizing it. I can understand their perspective in some degree because they're getting used to it. It's a new thing they're beginning to kind of recognize, and they're being careful because I think surgeons many times are taking advantage of it. They're calling things lipidem when it really is not, and I've talked about that. You cannot be irresponsible with this. It's going to backfire on the community. But
Yeah.
I do believe it is a disease that should be covered by insurance. It's a shame at a minimum that patients are paying for things for insurance policies and it's not covering their suffering with things with it. And here is they cover things that where many times it's a wrong diagnosis. They'll cover weight loss surgery, bariatric surgery. The patient wasn't primarily obese, they primarily had lipedema, or they'll cover vein surgery, which can result the problems from lipedema, but they're not covering the primary disease. So because I believe it should be covered, I believe every patient should have the best opportunity for coverage. And I have an insurance team that I provide the resources for and staff because I want every patient to have the opportunity for the best coverage. We do things in terms of our documentation, everything to make sure that the patient has the best chance. But that said, it still is a challenge and a battle with it. Every patient that we get approval for, it's a huge win with things like that. But
Yeah.
it's still, you have patients that are many times stage 3 or stage 4 patients, advanced patients that can barely walk, and they're not getting covered with it. And sometimes there's no rhyme and reason to it. Sometimes
Yeah.
it's the same plan, out of state or whatever, that might cover one patient that might not cover another patient with it. So it's a problematic area still.
That's pretty wild, honestly. That it's been an issue for this long, and like even insurance companies, they will cover medical weight loss surgery, like it sounds like from you, but then they won't cover the lipedema surgery.
And I said, bariatric surgeons, I'm just going to say this, they have a responsibility to screen for lipedema.
Yeah.
A lot of the patients they're seeing, I would say a significant proportion of patients, maybe between 30 and 50%, have lipedema. And they're either not recognizing it or they're choosing to ignore it with it and going ahead with bariatric surgery when really it's really not initially the right thing to be doing on those patients with it.
Yeah. So that's just kind of also the medical provider needs to be making sure that they're screening for these different things so that they can be doing the correct treatment plan and intervention for them.
But again, it all starts with proper diagnosis.
Yeah.
It's not only just those physicians. We got to be, the primary care physicians are seeing these patients every single day or week at least. Need to be
Yeah.
picking up on it because doctors like to diagnose. I mean, they love to. Oh, you may have this condition here. I mean, they really love to diagnose. We got to teach them to be diagnosed in this condition, and that's actually one of
Yeah.
the aims that I have. I have an organization called Lipedema Society, and one of the main focuses, besides certification for surgeons and certification for people that can diagnose it, is teaching medical professionals about lipedema so that they can properly diagnose it.
Yeah, really getting that word out there, because is this something that people are focused on, like in medical school? Are people learning about lipedema, or not really right now? None.
Not at all. I mean,
Yeah.
I would be surprised. I mean, I'd be maybe one or two schools out of 130 or so in the US, maybe teaching it. I'm sure it's less than a handful at most, if any, quite honestly. Some of the other healthcare fields I think are more likely, like physical therapy and maybe nursing. And a lot of it I go back to, we gave it too weak of a name. Lipedema just sounds like something made up and it sounds like lymphedema. We should have called it lipofibroedema or some other condition because
Yeah.
it would have had a better chance of being taught in medical school. And that's a shame.
Yeah. Wow, that is pretty crazy, honestly, that it's not being studied more, not being educated more, even in medical school and everything. And
Can I can I can
so,
I, can I ask you a question? How did
yeah,
you hear about?
I actually heard about it from you. Yeah.
Great,
So,
fantastic. How did you come about that? Just some educational thing that we do,
yeah, exactly. It was, I think, online somewhere that I saw, and I was like, oh, like this looks interesting because it's something that I don't know
right?
about. It's something that I'm sure a lot of my audience doesn't know about as well. And so I just wanted to kind of help spread the word about this and make more people aware that this is a thing that a lot, like you said, 10% of women, that is a large portion of the population. It's not like 1%, 0.01%. It is 10% of people,
Yeah,
women.
yeah. So that's cool. I mean, that's how knowledge spreads. And
Yeah.
that's what that's great. So you're spreading the word. Your viewers are now learning about it. I mean, then people have responsibility to talk about things now. I think it's really, we're kind of like in this age of awareness of lipedema. I'm really kind of feeling it that things are changing now. I'm seeing it on social media and stuff, and it's very cool. It's kind of like the new kind of talked about disease with things, and it should be.
Yeah, I feel like social media helps spread awareness about a lot of things, and honestly, just people having more access to education. Like even 10, 15 years ago, it was hard to get access, harder at least, but it's becoming easier and easier. And even now, like you could go on ChatGPT and be like, what is lipedema? And you at
Yeah,
least get
yeah.
somewhat educated. It's probably not the best education out there,
Mhm.
but at least people have access to that information.
Yeah, it's important. Listen, I think I discounted social media and the internet years ago. I just had this thing against it. I'm an old guy. I got young
Yeah,
kids. It just would just bug me and stuff like that. And I think there's a lot of kind of silliness on there also and potential bad things. But on the other
for sure.
side, listen, it's the power of being able to spread information. You can't deny it. It's huge. So
Really
that's why I'm here.
Yeah, and I mean, obviously there are bad things on social media too. There's misinformation, there's, especially with the medical industry, anyone can kind of say whatever they want on social media, but
Yeah.
it also is a great tool, but you just have to find your information from the right sources too.
Yeah. Yeah. Yeah.
Yeah. And so you've recently developed a supplement line specifically for lipedema. And so can you kind of talk more to this? What inspired you to do this and how is this kind of helping your patients as well?
Yeah. Yeah. Well, it's just coming out very soon.
Yeah.
So early summer, it'll be out. And it's something that was a concept of mine many years ago. And it's been about 3 years in the making. So it's been a long process of fine tuning things and formulating things in just the right way and getting the right ingredients together. And it's something that I think is going to fill a great need. There's a lot of supplements out there that there's been a lot of great research on showing the benefits of it in various different ways with swelling and inflammation. And it's being used by the community. There's a lot of patients who find out about certain supplements on Facebook groups and this and that begin to then seek it out. And so I wanted to make it done in a way that was really a more structured way and to have it more accessible and more convenient in a cost-effective way. So the program is a 3-part program. I initially began to think, well, everything can be done in like a one-a-day pill, one-a-day vitamin type of thing, and it just really can't. I mean, there's so many components to it, so many important areas. So it's got 3 parts. One is helping inflammation. It's anti-inflammatory. That's one component. That's a major important thing with lipedema, because in lipedema, one of the pathophysiologic processes is inflammation, and that inflammation is creating fibrosis, which is scar tissue. And that is making things worse with congestion and affecting the lymphatic circulation. Anti-inflammation is important from a dietary standpoint and now supplements also. Well, let's talk about the next thing. Lymphatic support is another important area. We know that in lipedema, patients are prone to swelling. There's a movement of fluid across lymphatic membranes. Reducing swelling is important. So the next part is lymphatic support. And the final part is metabolic support. Because in lipedema, fat is very, very hormonally active and it begins to progressively slow a person's metabolism down. And as it progresses and gets into stage 2 and stage 3, people begin to lose the metabolic battle with lipedema. So the supplements for the lipedema, the metabolic part of it are very important also. So it's meant to be a 3-part program, but sometimes you can just target individual things. So let's say a person has no swelling, only in pain, then they would go on the anti-inflammatory part of it.
Okay, yeah, that's amazing. And so is that for people post surgery or they can use it pre surgery as well?
I really, designed it in a way really to be used in kind of every patient, and I think
Okay.
it's got its role, a greater role, maybe just simply prevention of progression of the disease with things. So I think that once a person's diagnosed with lipedema, it's a consideration to go on a supplement program with it, because they want to do everything to prevent and slow progression. There are no medicines for lipedema. It's probably going to be years. We have a research division, and I want to see us advancing. So eventually we have medicines for lipedema, but there are no medicines right now for lipedema. So supplements are important with it. But I think it's just prevention in patients in general who get diagnosed, who are not ready or wanting to do surgery yet or not needing surgery yet. And then patients after surgery, for further prevention. It rarely comes back after surgeries, but still, you want to do everything in your lifestyle to prevent it from ever coming back. You want to be on a respectful diet. You want to still pay attention to compression therapy. You still want to take the right types of supplements with it. So it's across the board.
For sure. That's amazing. Yeah. And you said that's coming out early summer, correct?
This summer, correct.
Awesome. Amazing.
I'm saying that with confidence because it's now weeks till it's going to release. What are we in May
Yeah.
now? So early summer.
And if you've been working on it for 3 years, you're like, oh my gosh, it's finally coming. Yes.
Well, it's a lot of work, coming up
Yeah.
coming up with coming up with a product line is it's a lot of work with things, and I've got so much going on in all these different areas. So it's had a lot of energy and time devoted to it.
That's very exciting then. And definitely let my audience know where is the best place to find you, where is the best place to find your institute online, all of those fun things. I'll also include them in the show notes as well for easy access, but definitely give everybody some ways
Yeah,
to find
it's
you.
it's one of the hardest, questions I get to answer. I also need to answer it wrong. I think there's a link in the bio below. You can Google my
Okay.
name, Dr. David Amron. There's the roxburyinstitute.com. There's the Advanced Lipedema Treatment.com. It's really our website about the lipedema program itself. Again, there's a really good book about it. If you're really truly interested in learning a lot more about understanding the role of lipedema surgery and liposuction, there's a great book. I think that will be in the bio The link in
Yeah.
the bio below. Also, in the supplements, there should be a link about that too.
Yeah, I'll include everything in the show notes. Thank you so much for coming
Yeah,
on and educating us a
great.
little bit more about lipedema. I'm sure this was very informative to a lot of people, so I really, really appreciate it.
Great. Well, thank you for being part of that important web of knowledge that we're all spreading. So great. Thank you so much.
Thank you.
Okay.